Hello there, and welcome. My name is Calliope, and I'm going to be your osteopath today. Now, as I understand it, you are one of our new patients. Is that correct? I see. Well, I'd love to tell you a little bit about osteopathy, its history, its background, if you wouldn't mind. Wonderful. So, osteopathy was started in 1874 by Dr. Andrew Taylor Still. And he founded this as a holistic form of medicine with a focus on wellness and the concept of the body being a self-healing, self-regulating mechanism. Now, my job is to help facilitate that healing by getting to the root cause of any sort of dysfunction or imbalance in the body. And I create the conditions that the body needs to heal itself. Now, over the history of osteopathy, it's been a bit outside of allopathic medicine, but nowadays a lot of times it works with it. And actually, I am a doctor of osteopathy, which means that I am, for all intents and purposes, a medical doctor, but I also have training in osteopathic manipulative treatments. Now, there are over 40 different techniques that we can use for OMM, or osteopathic manipulative medicine. This includes techniques like the high velocity, low amplitude thrusts that you might be familiar with as the cracking and popping that chiropractors do. We also have techniques like myofascial release or muscle energy, traction, counter strain, quite a few different things we can use. I mean, even lymphatic drainage has its place in osteopathy. So there is a bit of similarity with, say, chiropractic and even physiotherapists with doctors of osteopathy and those who practice osteopathy. But the difference is the doctor of osteopathy is a medical doctor. They're trained in medicine, and also they have many more techniques to use than just, say, a chiropractor. It's a lot safer to use than chiropractic. And I'm not just treating the joints, but the entire body. The nervous system, the fascia, the circulatory system, the emotional body, the spiritual body, all these different things all go into osteopathy. So, if you wouldn't mind, I'd love to hear a little bit about why it is you came to me. Okay, let me just grab my chart. We can note that down. Okay, and tell me a little bit about that in terms of when you started feeling this way. How severe is it? Does it impact your daily activities? Okay, and when did you say this started for you? Okay. Well, I certainly think that is enough to get us started, and we can work on your evaluation. So an osteopathic evaluation looks sometimes similar, but often quite a bit different from what you might receive at your allopathic doctor's office. So I'm going to be looking at you not just as you're sitting here, but I look at you as you're standing, as you're lying down. We have the anterior view, posterior. I look at you at the side. We'll put some things in motion. There is a lot of movement, and there's a lot of hands-on evaluation. It seems that a lot of times when we go to our PCP or a specialist, it's a lot of just questioning, and sometimes they really just don't even touch you. But the osteopath is all about being hands-on. All right? Wonderful. So for this examination, I'm going to be needing to touch you. Is that okay with you? I have your consent to do that? Excellent. So let me get us started here. So I'm going to be looking for a few things in particular. This is called the TART group of symptoms. So we have tenderness, asymmetry, restriction in movement, and we also have tissue texture changes. So sometimes the tissue will feel very hot, sometimes it'll feel very hard. There might be something going on in that tissue that tells me to look a little deeper. So we will start from the front. So if I could have you stand up, and we will check your symmetries here. So ideally, the body is going to be pretty much symmetrical and level all the way through. Your head isn't going to be tilted, your shoulders are going to be level, your hips should be level, but sometimes that just doesn't work out for injury or maybe just the way we hold ourselves. So I'm going to just look at, for example, the occiput here, the level of that, and the chin, and we have the shoulders, even the clavicles here can get misaligned. We have the spaces between the side body and the arm. Sometimes if we are tilted or sway one way, there's a bigger gap between the arm and the side body on one side or the other. And we have the waist as well, the iliac crest here. We have the hips, and we have the knees, as well as the ankles. So the body is one whole system, all works together. If one thing is out of whack, then it's very likely that it's caused a chain reaction of things. My job is to get to that original point that caused all these other things to happen. So let me just note down. Now I'm going to have you turn around for me and stay standing. And what I'm going to do is I am going to take a look at the spinous processes and the transverse processes. So you have all those notches in your spine, so you can feel the spinous processes, and the little bars that come across, those little pieces of bone, those are your transverse processes. So let me know if there's any pain or tenderness as I am feeling the spinous and then the transverse process. We have right here C7, top of the scapulae, down to the inferior border of the scapulae, thoracic vertebrae, all the way down into the sacrum here. I'm going to be feeling around the sacrum quite a bit, and in a minute I'm going to have you bend forward as well. Okay, just palpating here. Okay, and is any of this tender? All right. Now I am going to be putting my hands on your hips here, your waist, and my thumbs will be right on the sacrum there. If I could have you bend forward and try to touch your toes, we're going to do a forward flexion test. Okay. All right, so we have a little bit of misalignment there. And if you want to just come back up real slow. Okay, so yeah, that's pretty common. I mean, we might get a little bit of rotation in a vertebra or two. Might get a little bit of shifting in the sacrum. Now let me feel the inferior lateral angles here. Okay, and is this painful or tender at all? Okay, give me just a moment. All right, and let me just check the knees and the ankles as well from the back here and make sure that they're all in alignment. Sometimes things can get a little wacky if you're kind of tilted up on one side. We can find problems with that in the feet and the back. Okay, so that looks good. Now I would like you to turn to your side, if you don't mind. Yep, I just want to look at the curvature of your spine. So we're looking at the posture and making sure that we don't have an exaggerated curve and that we don't have any flatness where there shouldn't be. Okay, is any of this painful or tender? No. Well, it's actually not too bad. Most people I see tend to have poor-ish posture. It's certainly not as bad as that, so that's good. Okay, and just want to make sure, for example, the ear is perpendicular with the shoulder here, that's all in line. Okay. And I didn't see any issues with any tilting either. So we are going to move you to lying supine. So I'm going to have you lying on your back, and this will be pretty much where you stay for the duration of the examination and the treatment that I'll be doing with you. So you can get comfortable, get a little cozy, and we'll continue with the examination. Are you comfortable like this? This is fine? Okay. Wonderful. Now I'm going to just pop on my glasses real quick, since we're going to be dealing with quite a bit of the body. I just want to make sure that I'm seeing everything correctly. And I'm going to be starting down here by the ankles. So let me get rearranged here. And we're going to start by doing some bilateral traction at the ankles. So I'm just going to very gently, very slowly pull the body. And you can often feel where maybe some tension is arising. You might be able to feel some restriction. And ideally, the body kind of moves like water. Everything kind of flows together. But if you don't see that sort of normal movement, then obviously there's something going on. Okay, I'm just going to put your legs back, and I'm going to just lift each leg to check if there is any obvious heaviness in the leg. If maybe there is a bit of a lymph issue, if we're retaining fluid. Seems to be good with that leg. Okay. Good. And now I am going to be taking each leg, and I'm just going to be standing here, and I'm going to rotate the leg a little bit in here, and we're going to do some compression and a little bit of traction here. So I am going to have this all locked, and then I'm just going to gently press in and pull back. Compression and traction. Compression and traction. Okay, and we can do that with the other side as well. Just bring up the leg, rotate it a little bit inward, and then we're going to do compression and traction. Is any of this painful for you? Compression, traction. Okay. Compression and traction. Wonderful. Now I'm going to come over here, and I'm going to be putting my hands on the anterior, superior iliac spines. And we're going to check the symmetry. So ideally, my hands should be symmetrical, but sometimes one might be a little bit out, one might be a little bit out there. So we check the symmetry. And then we can also rotate the fingers and go more towards the umbilicus to see if there is any discrepancy or asymmetry there. that looks good there. And now I'm going to do a squish test in which I'm going to be pushing down and a bit in on the hips and see if there's any restriction, if maybe I can't go down as far on one side or another. I'm going to be putting my weight on the hips here, okay? Let me know if this is painful. Okay, and how is that? Alright, so now I'm going to take my hand and I'm going to be doing a bit of a visceral examination and just working up the midline of the body. It's almost got a caterpillar-like motion to it. And we'll go all the way up, past the clavicles. Okay. And I'm going to come back around, and then let's go ahead and check the shoulders. So I'm just going to be pressing in on the shoulders and just checking their restriction, their alignment, and even a bit into the neck here. Any pain or tenderness with this? No. Okay. Good. So I think for you, for a beginning treatment, I'd like to do some myofascial release to start with. And this is something that essentially everyone benefits from. There isn't anything glaringly obvious with your body, no obvious dysfunctions that I think would take some time and effort to work with, but I think we can treat what we do have going on quite well with a few different techniques. Now, I am going to be working on the diaphragms of the body. So we know the respiratory diaphragm, the big muscle that helps us breathe, but we also have some other partitions in the body, some other diaphragms. We have the pelvic one that divides the legs from the torso. We have the respiratory diaphragm. We have the thoracic diaphragm that divides our torso from our neck. And we also have the occipital diaphragm, which divides the head from the neck. So we're going to do a little bit of myofascial release. So I'm going to have my first hand, my dominant hand, underneath the sheet on the table here, and my other hand is going to be on top of your body here, and this is going to be doing some compression. So I'm going to start around the sacrum and L5, or the fifth lumbar vertebra. And there's just going to be a little bit of movement here. So the diaphragms are very important because these partitions are what so many structures flow through. A lot of the body is up and down, but these cross the body, and you have your blood vessels, your nerves that flow through. I'm just going to keep some pressure here. So we want to make sure that everything is able to flow freely, that there's no restriction, because everything should work correctly as long as there's no hindrance. So it's my job to take away anything that might be blocking the flow of blood, lymph, what have you. Good. And we can stay here for quite a long time. It's just however long your body wants a certain spot to be worked on. Good. I'm just feeling for your body's cues, or listening, as it's called, and waiting for it to soften when it's ready. Keeping that compression there. And then we can move up a bit and we'll work on the respiratory diaphragm. So we have some compression. I have my dominant hand on our thoracic vertebrae. And my compression is more around the bottom of the rib cage. So what I'm doing is I'm working in 3 different planes of motion. We have side to side, left or right, and your body is guiding me as to what it needs, and I just listen and follow along. And we have up and down, as well as rotating clockwise or counterclockwise. And using these 3 different planes of motion, I can stack my pressure, my touch, to hit the spot that your body needs addressed the most. Good. There we go. Okay, and then if we come up to the thoracic diaphragm, so my hand is going to be compressing along the sternum, kind of that sort of spiritual heart center, while my dominant hand is underneath, and we work side to side, up and down, and then rotated clockwise or counterclockwise, just depending on whatever your body needs the most. For the occiput, I'll be doing what's known as a sub-occipital release. And so I'm going to have my hands behind your head. Work just a little bit longer. I can feel it start to soften, and the tissues tend to warm up quite a bit as well. So for the sub-occipital release, I'm going to be using my fingers in here, right in there. Now, a lot of myofascial release is just being very careful as to where we are targeting and then holding it and waiting for the body to respond. And with myofascial release, we also have to take care when we are coming back from the tissues. You can't just let go, but instead you have to gently lift off so that we don't get a sort of recoil effect. Good. Now I'd like to do something known as a CV4 compression or a CV4 bulb decompression. And I'm just going to be using the thenar eminences of my hands and resting these on the occiput here. And this is also sometimes called the compression of the fourth ventricle. And it's described as this sort of resetting point where we're bringing all the fluids to a stillness and giving the body a little bit of a reset. We'll just sit here for a few moments. Really, this can go as long as the body needs it. We'll just sit here for a few moments. And then we can finish off with working on the pericardium. Now for the pericardium release, I am going to be putting my right hand on the pericardium here, my left hand on top, and I'm going to allow the tissue here to tell me where I need to be until I feel the restriction. So the pericardium is the tissue that surrounds and protects the heart. And we are going to try to get it to relax. So when I get to the spot I need to be, press down and release. Feel around. Press. Release. Feel around, press, and release. There we go. I'm just going to tap in there, pressing with my fingers to close that up. Okay. And that is going to conclude our treatment. Now, the goal for osteopathy is to eventually get you to a place where you don't need to come back, except maybe once in a while for maintenance. So it's up to you on when you feel you wish to come back. I could see you maybe in a couple weeks, maybe in a month, and we can see if there is anything we need to work on, anything we need to follow up on, and we can make a plan from there. All right? So if you want to make your next appointment with the receptionist up front, and I hope to see you back soon, right? I'd like to thank you so much for allowing me to work on you today. I hope this makes you feel a lot lighter, a lot more in balance, and I hope you have a whale of a day and a good rest of your night. Thank you. Bye now.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything, from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon, or I also have a Ko-Fi link